Hello everyone. Today I'm going to do the video about how to do the CBG test. CBG test is the level of circulating blood glucose as measured by glucometer analysis of a finger stick sample. And its regular measurement of the CBG allow diabetes to make a frequent adjustment in their calorie intakes, exercise level, and use of anti-diabetes medication. The purpose of the CBG play as an important part in achieving level of diabetes control which are associated with reduction in risk of developing diabetes complication. So before we going to do the test, we need to have a preparation. So for the first of the preparation, we have a determine. So we need to determine the frequency and the type of the test for the patient, and the client need to understanding of the procedure. And after we determine, we need to assess. So we need to assess the client's skin at the puncture site such to determine if it is intact or the circulation is not compromised. And then we need to check the client record if there is any medication that might cause prolonged bleeding, such as anticoagulant. And after that, we have to prepare the equipment and the supply. For the equipment and the supply, we have calibrate blood glucose meter. We had glucose meter compatible reagent strip 2x2 gauge, warm cloth, antiseptic swab, disposable glove, and sterile lens and lens injector. And for the procedure, the first we need to introduce ourselves and verify the client identity, and then explain the procedure to the patient so that patient will be understand what are you going to do to them. And after that, we need to perform hand hygiene and then provide privacy to them. Then select and prepare the vascular puncture site, avoid side beside bone, and hold the finger in the in a dependent position. If earlobe is used, rub it gently with a piece of gauze and clean the side with antiseptic swab or allow to dry completely. And after we clean the side with the antiseptic and then allow it to dry completely, we going to obtain the blood specimen. Before we doing that, we have done with the glove and then place the injector if used, and then release the needle through the permitting it to the pierce the skin, and make sure that the lens is perpendicular it to the side, or pick the side with a lens or the needle using a darting motion. And after that, we do web the first web the drop of the blood with a cotton ball, and then gently squeeze but not touch the puncture site until the light drop of the blood from, and then hold it reagent strip under the puncture site until adequate blood cover indicator sharp square, and then the part will be absorb the blood and chemical reaction will be occur. Do not smear the blood, and ask the patient to apply the pressure on the puncture site with gauze 2x2 or 4x4. And after that, we need to expose the blood to the test. So as soon as the blood will be placed on the test strip, and then follow the manufacturer recommendation on the glucometer and monitor the time as indicated by the manufacturer. And after that, measure the blood glucose. For the measure the blood glucose, we need to place the strip into the meter according to manufacturer or instruction, and after that, uh, most of the glue meter will be display the glucose reading automatically, and switch it off the meter and then discard the strip and the gauze, and then discard the lens into the sharp container. After that, we document the method of the testing and the result of the blood record, and then we check for order for sliding scale insulin based on the capillary blood glucose results. So we can admit insulin as a prescribed to the patient. That's all of the procedure how we do the CBG test to the patient. Thank you.